So good morning. 364 days ago, this team stood here and laid out how Massachusetts was going to reopen the economy one step at a time. It was a major step forward after several long months of despair. Back then, effective vaccines were just an idea. About 7 months after that, when the vaccine became a reality in December, we laid out how Massachusetts would vaccinate 4.1 million people by this spring. Today, Massachusetts leads the nation in vaccinations, and we're on track to meet the goal that we set for ourselves back in December. Over 3.2 million people in Massachusetts are fully vaccinated, and over 4 million people, 75% of all adults, have received at least one dose of the vaccine. Virtually all of our residents who get a first dose return for their second, which is why we're confident that our goal of vaccinating 4.1 million people here in the Commonwealth will be achieved in early June. We've said since day one that we'll get through this together because the people of Massachusetts are strong, kind, and willing to sacrifice to help their neighbor. Today, more than ever, we know that's the truth. Massachusetts is effectively battling back in its campaign against the virus. Nearly every student in the state is back in the classroom, and we've reopened nearly every industry. We're safer, smarter, and better equipped in this fight than at any time since it began. And thanks to all your work, we're willing to take the next step forward together. Effective May 29th, the Commonwealth of Massachusetts will lift all industry, COVID restrictions, and capacity limits. Massachusetts is on track to reach its goal of vaccinating 4.1 million residents by early June, and this level of protection makes this step possible for the people of the Commonwealth. The science shows that vaccinated people are well protected against the virus and unlikely to spread COVID. Effective May 29th, the face covering order will also be rescinded and will be replaced by the Center for Disease Control and Prevention's new guidance for vaccinated and unvaccinated people. At that time, the Department of Public Health will issue a public health advisory urging all unvaccinated residents to wear face coverings in most indoor settings. The department will advise all vaccinated residents that it's safe to go back to doing the things we all used to do before this pandemic, consistent with the CDC's new guidance. The Department of Public Health will also be issuing a new public health order that will mandate the use of face coverings by everyone, whether vaccinated or unvaccinated, in a small number of specific places such as nursing homes, healthcare settings, public transportation, and in schools. Again, consistent with CDC's guidance. We'll also end the current state of emergency on June 15th. We have a lot of work to do between now and the end of the month, transitioning out of the current state of affairs. But none of that work is more important than carrying out Massachusetts' national leading vaccination effort. We'll continue knocking on doors, making calls, setting up pop-up sites, and doing everything we can to expand access to vaccines. We're working day and night to reach everyone where they are, and we know this is more important and harder to do in our hardest hit cities and towns. There's no question we've made tremendous progress. Everyone who works, lives, or studies in Massachusetts has been or will be offered a vaccine at a time and place that is convenient for them. There's no cost and no insurance or ID required. If you've not yet gotten vaccinated, please get vaccinated to protect yourself and your family. As we transition away from the current restrictions, businesses may choose to set their own requirements for vaccinations or masking. We encourage them to do whatever works for them, for their employees, and for their customers. And we also encourage everyone to be respectful and to follow those requirements if a private organization puts them in place. We got this far because the people of Massachusetts followed the public health guidance to keep everybody safe, and we must continue to do our part to respect any rules and requirements that individual businesses or employers may choose to put in place. The temporary limits and restrictions imposed on the private sector and on individuals were the most difficult decisions I've ever had to make. The loss and the isolation so many of our friends and families experienced is likely to impact all of us for a very long time. The Commonwealth was tested. Employers, small businesses, hospitals, healthcare workers, and first responders were pushed to the edge. But together, we all fought back, made changes as the facts on the ground changed, and never, ever stopped moving forward. We all know this virus will be with us after any rule or regulation expires. But thankfully, the knowledge of our medical community is far greater than it was before with respect to how to treat COVID, combined with the results of our highly successful vaccination effort, allows us to get back to living our lives. And none of this would have been possible without the safe and effective vaccines that are widely available in over 975 locations across Massachusetts. And none of this would have been possible without everyone who calls Massachusetts home stepping up and doing their job. We lead the nation in vaccination rates, but until you are fully vaccinated, we're strongly advising you to continue to wear masks, wash your hands frequently, and keep your distance. The recent medical studies have informed the new CDC guidance and makes clear that vaccinated individuals are thoroughly protected from illness and very highly unlikely to transmit the virus at all. And Massachusetts is getting vaccinated faster than virtually every other state in the country. We've gotten to this point because we followed the science, and the people of Massachusetts did the hard work and made the sacrifices. We are now prepared and protected, and we can move forward together.